Alvin. I'm representing the Secretariat of the OneNeurology Partnership, and I'm tasked with some housekeeping rules for you all today. We ask that when you are speaking, you remember to press the on button for your microphone, and very importantly, when you are not speaking, to press the button again to switch the microphone off. To all of our speakers on the panel here today, Lydia Makarov is going to be our timekeeper and will notify you of 2 minutes and 1 minute left. And with that, I am going to hand over to the chair of the OneNeurology Partnership, Abdel Ibrahim.
Thank you, Eva. Hello, everyone. Excellencies, colleagues, and friends, good afternoon and welcome. My name is Abdel Fattah Ibrahim. I'm the chair of OneNeurology Partnership. I'm also the head of communications, campaigns, and advocacy at the Multiple Sclerosis International Federation. It is my honor to open this side event at the World Health Organization. Let me start by thanking the Ministry of Health of Italy for co-sponsoring this event and joining us today, and also our partner across the neurological community and those who co-organize this event, including the Multiple Sclerosis International Federation, International Bureau of Epilepsy, and Alzheimer Disease International. Today's event comes at a really important timing. In recent years, we have seen unprecedented support and commitment for neurological conditions, from the IGAP to the 2025 UN Political Declaration on Non-Communicable Diseases. Together, they provide recognition of the growing burden of neurological conditions and a roadmap for action. But commitment alone is not enough. The real change lies in implementation. As many of you know, the neurological conditions are the leading cause of disability worldwide. Yet, care and healthcare in particular remains deeply unequal. Too often, neurological conditions and brain health remain under-prioritized within the national NCDs strategies, universal health coverages, and broader health system reforms. At the same time, with the growing discussion and the evolvement of health systems, the global health structure reforms discussion that taking place right now at the World Health Assembly present a clear opportunity for neurological conditions to be included and to be part of the wider healthcare system reforms. But at the same time, there is a risk. There is a risk to be once again left behind. This is why today's discussion is important, because it is about ensuring brain health and neurology is part of the global health agenda. And it is ensuring that we are turning and working together to turn global commitment into real change for people. In our first session today, we will explore implementation in practice, drawing on the WHO Global Status Report on Neurology. And we also will hear examples from multiple sclerosis and epilepsy, and as well as palliative care for neurological conditions. While in our second part of the session, we'll explore what the 2025 UN Political Declaration means for neurology and how it can be used to accelerate action on neurology. For us at the OneNeurology Partnership, we represent a united voice, working together to ensure neurological conditions are recognized, prioritized, and well-resourced both at global level and national level. But we can't do this alone. Progress depends on a strong commitment from member states and continuous meaningful engagement with WHO and cross-sector collaboration, while keeping people with neurological condition at the center of what we're doing. I'm really hoping that we leave this room today with a shared sense of responsibility and action. And let me put it that way. This is our call for action to member states. Please do develop and fund national neurology and brain health plans in alignment with IGAP. and integrate neurological conditions into universal health coverages and NCDs strategies. And to our colleagues at the World Health Organization and UN partners, continue the important work you're doing to help and support the implementation of IGAP and other global framework and strengthen accountability and ensure neurological conditions are fully embedded into the health system reforms. And to my friends at the civil society organization, as well as people with lived experience, many of them are attending online with us today. Please continue the important work you're doing. Raise your voice, strengthen accountability, and ensure policies reflect your realities. If we act together across sectors and regions, we can ensure that brain health is no longer overlooked and that millions of people can access the health care and support they need and deserve. Thank you so much for joining us today. And with that, I would like to, with great pleasure, invite Dr. Sergio Iavacoli, General Director for Prevention at the Ministry of Health of Italy, to deliver his opening remarks. Thank you.
Thank you, and good afternoon, distinguished colleagues, representatives of member states, WHO, and the OneNeurology partnership, which are very pleased to share. Also, greetings to other scientific societies that are here today, patient organization, and civil societies. It is for us, in fact, a pleasure and an honor to co-sponsor this event, and also for me to address you today on behalf of the Italian Ministry of Health. I would like to thank OneNeurology and all partners involved for promoting this event on this very important topic, which Italy is pleased to co-sponsor within the framework of the World Health Assembly. Brain health is, in fact, one of the most important public health challenges of our time. Neurological disorders are now recognized among the leading causes of disability and loss of health worldwide, with a growing impact on individual, family, health, social care system, and economies. This burden, in fact, is expected to increase further as population age, and as you know, Italy is among the countries with the highest average age and life expectancy. And we also know that these years, the increase, 1/3 of them are coming with the burden of high disabilities, and neurological disorders are an important part of this. And so the WHO Intersector Global Action Plan on Epilepsy and other neurological disorders 22-31 provides a clear and ambitious framework for action. It calls, in fact, on member states to integrate neurological disorder into national policy, strengthen prevention and early diagnosis, improve access to care, essential medicine and technologies, promote research and data system, and protect the right and the dignity of people living with neurological conditions. Italy fully shares this vision. The Ministry of Health has long been committed to promoting neurological and mental health through prevention, early detection, appropriate care pathway, integration between hospital and community services, and support for patient, caregivers, and family. In fact, a large on mental health, and I'm seeing here Deborah, where we shared recently in 2022 the hosting of the Global Mental Health Summit. You know that Italy was the country first to deinstitutionalize psychiatric disorders. A major area of action is dementia, going back to the today framework theme. Italy was among the first countries also to adopt a national dementia dementia plan, and the ministry is currently working together with the Italian National Institute of Health, region, scientific society, patient and family association, and other stakeholders on update this plan. The new framework is aligned with WHO priorities and focus on awareness, prevention, integrated care, caregiver support, information system, research and innovation. Dedicated national resources have supported regional projects on early diagnosis, telemedicine, telerehabilitation, cognitive stimulation, psychoeducational intervention, and support for caregivers. This issue of caregivers is very important because many caregivers are also part of society at their time. So to support them within family is essential, particularly in this very heavy burden for families and communities. National guidelines on dementia and mild cognitive impairment have also been developed together with tools to map services and reduce territorial inequalities. Prevention is a key part of this agenda. Scientific evidence showed that a substantial proportion of dementia cases could be delayed or prevented by acting on modifiable risk factors across the life course. In Italy, prevention of dementia has been increasingly connected with broader policies on health lifestyle, cardiovascular health, mental well-being, social inclusion, and environmental health. Italy is also strengthening action on Parkinson's disease, which is included in the National Chronicity Plan, and on mental health through the National Action Plan for Mental Health, which has been recently adopted for the current term 25-2030. In this context, the recent proposal promoted by the Italian Society of Neurology through the One Brain, One Health Manifesto and the Italian Brain Health Strategy 2024-2031 represent a valuable contribution. The Ministry of Health welcomes this debate and is ready to renew the structure, the dialogue with scientific society, the Italian National Institute of Health, regions, patient organization, and other stakeholders. The aim is to explore a national framework that better connects existing initiatives on neurological disorder, mental health, prevention, chronic care, rehabilitation, research, innovation, and the common umbrella which puts brain health perspective at the center. This is how we can move from international commitment to practical implementation by building integrated policies, strengthening services, investing in prevention, and ensuring that people living with neurological and mental health conditions remain at the center of our action. Italy then remains committed to working with WHO, member states, and partners to advance brain health as a public health priority to the life course for all population. Thank you, and I wish you a productive and inspiring discussion.
We now come to the next section of our event, and this is session 1, delivering on brain health, what the Global Status Report means for countries. And I would like to introduce first and foremost Professor Stephen Lewis, who is the President of the World Federation of Neurology, speaking about the Global Status Report, sharing with us progress and some gaps.
Thank you so much, Dr. Galvin, and thank you to all of the One Neurology partners. Thank you, Honorable Dr. Ivacoli, Dr. Costello, Tarun Dua, and all of the esteemed representatives of the WHO, and I really very much appreciate the invitation on behalf of the WFN to be here today. So let me set my timer. Okay. So what is the WFN? The WFN is a Federation of Neurological Societies. It was formed July 22nd, 1957 in Brussels. July 22nd is World Brain Day, not so coincidentally. It is based in London, a UK charity, and our mission for about 15 years has been to foster quality neurology and brain health worldwide. Brain health has been in our motto, with the emphasis placed in under-resourced areas of the world. Next slide, please. So the WFN has 126 member societies, loosely grouped into 6 regions of the world. African Academy represented by the African Academy of Neurology, the Asian Oceanian Association of Neurology, Pan-Arab Union of Neurological Societies, Pan-American Federation of Neurological Societies, the EAN, European Academy, and the American Academy of Neurology. Next slide. Our main activities are capacity building, such as through our training centers, particularly in Africa, and one in South America as well, and our grants. Education, including free e-learning days throughout the world, and our biannual and now annual World Congress of Neurology, our advocacy efforts, such as through the WHO and the UN, and our publications, particularly World Neurology and Journal of Neurological Sciences. Next slide. 2017, the World Federation was privileged to participate with the WHO in the Atlas of Country Resources for Neurological Disorders, and this is really this is old, but not much has changed, unfortunately. And those 2 little humps, the one on the left on the top and the one on the left on the bottom, represent the number of neurologists per 100,000 population. The top one is based upon region, so that's Africa, the top, and the bottom is based upon income. So less than those little humps are less than 0.1 neurologists per 100,000 population in those regions. In the top one, the other tiny little hump is Southeast Asia. Next slide. I'm sure we all know that the Global Burden of Disease study showed that, published in The Lancet in 2024, showed that neurologic diseases are the leading cause of overall disease burden in the world. About 43% of people in the world suffer from a neurological disease, so somewhere more than 1 in 3. And of course, we're all aware of the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, which was adopted by the World Health the World Health Assembly in 2022. And I'll just skip over this slide. This is something well known to all of us, and been a remarkable accomplishment, and a great opportunity for all of us involved in neurology. But I do want to mention, despite the fact that brain health has been in the World Federation of Neurology motto for 15 years, brain health is actually a very new concept. When you get home today, look at something called Google Ngram. Google Ngram is a little toy you can play with. Just Google Ngram, put in the words, and see how often those words have been published in the English language literature in the last 100 or so years. So next slide. If you put in the word brain health into Google Ngram, you will see that it essentially didn't exist in the English language literature until after 2000. Those 2 words never existed in juxtaposition until after 2000. Next slide. And if you look on PubMed in Google and put in brain health, the first publication in the academic literature that had the word brain health the way we would think about brain health came in 2007, believe it or not. And now, as of 2025, 4,000 publications on brain health. Next slide. So it's quite new. The World Health Organization, as we probably all know, defines brain health as a state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. Next slide. Which brings us to the Global Status Report on Neurology, which was first announced by Tarun Dua at our World Congress of Neurology. We were honored that was the first report of the first announcement, if you will, of the publication of the Global Status Report of the World Congress this last October in Korea. Next slide. Showing really what is a baseline in 2022 for the responding countries. Of 194 member states, 102 participated, which represented 71% of the world's population. Next slide. But the bottom line is that essential services remain out of the reach for most people. Only 25% of member states, which was 49 countries, include neurological disorders in their universal health coverage benefit packages. And as we all know, critical services such as stroke units, pediatric neurology, rehab, and palliative care are frequently lacking or concentrated in urban areas. So going back to the slide from the number of neurologists, we have a lack of qualified healthcare professionals. This is the key slide, really. It's very difficult to read vertically, but nonetheless, the numbers say a lot. Again, this is the baseline data from 2022. And if you look at the lowest numbers, 38%, the goal was 80% of countries, but 38% of countries have at least one functioning intersectoral program for brain health promotion and the prevention of neurological disorders. 45% have at least one functioning awareness campaign or advocacy program. These are low-hanging fruit on that, and nonetheless, only 45%. If you look at the full denominator, that's 24% of all countries, presuming the other ones are actually answer no. And going to number lower down, 37% of countries presumably routinely collect and report on a core set of indicators for neurologic disorders. And finally, if you look at the bottom, 48% of countries, and our goal is 80%, will have developed or updated their legislation with a view to promoting and protecting the human rights of people with epilepsy. Again, even as low as 25% if we include the full denominator. Next slide. At the WFN, we've developed just this past few months under my presidency, a brain health strategy committee under the chairpersonship of Professor Riyad Guider. It will bring together multiple high-level stakeholders from around the world, representing multiple regions and multiple brain health initiatives. And our aim is to enhance communication and reduce silos, which will inform our brain health strategy. We do want to ensure input from psychiatry, child neurology, and other organizations. Next slide. We'll be including all of our regions, all of the other global professional societies, the World Psychiatric Association, International Child Neurology, and thinking many people around the room here today, global subspecialty and patient organizations. Next slide. We are absolutely pleased and honored by our collaboration with the WHO, including the Neurologic Atlas, which we mentioned earlier, our work with the IGAP toolkit, work with essential medications, the WHO's involvement in international informational sessions, and as I mentioned, the recent announcement of the global status report. Next slide. Our next steps are to develop a project to implement IGAP in sub-Saharan Africa. Having met recently with our colleagues here at the WHO, this will involve not only Ethiopia, which was the original planned country, but now 4 other African low-middle income countries, Kenya, Tanzania, Uganda, and South Sudan. These will involve workshops with ministry representatives, which will help develop a country roadmap for implementation of the IGAP, and the first meeting will be, I believe, in July of 2026. I want to end with something I really learned over these last few days. Next slide. The interconnectedness of all neurologic disorders and quote unquote other disorders. Neurologic diseases can be categorized as non-communicable, communicable, mental health, rare diseases, tropical diseases, whether they're neglected tropical diseases or non-neglected tropical diseases, and systemic diseases. Everything intertwines. We're all part of the same. So we like to think of ourselves as different, but we are part of this massive whole and really should not be ignored. So in summary, brain health is next slide. Brain health is a very new concept and is now a household word. There's an ever-expanding group of interested, committed stakeholders. We will continue to have inter-society and interprofessional communication and collaboration, such as what we are having today. And there's this interconnectedness between brain health, mental health, and all of the other diseases we talked about earlier, which bring us to the forefront. Much progress has been made. There is much, much more to go. And all of our strong partnerships with the WHO is absolutely critical. So thank you again for this remarkable invitation and for putting this group together today. Thank you again. Oh, next slide. I just want to mention World Brain Day, Brain Health Access for All, July 22nd. And I won't put up the slide advertising the World Congress, but Brain Health Access for All. Thank you.
Thank you, Professor Lewis, and to those who were trying their best to take as many photographs of those slides. The event is being recorded, so you will have access after the event. Moving to the next speaker, I would like to introduce Professor Mario Battaglia, Chair of the Multiple Sclerosis International Federation, who's going to speak to us about using MS as a blueprint for translating global policy into national action.
Thank you for the invitation and for the opportunity to highlight the position of MS at the world level. Of course, we start with the next. Thank you. We started pointing out the need of a new scenario for neurological illnesses. We remind the United Nations Political Declaration of Non-Communicable Disease of 2025, and of course, as was quoted, the Intersectoral Global Action Plan. So these are priorities, but the commitments to into national implementation is now important. Next, thank you. This is my conclusion, and I start with the conclusion, but I try to explain what I mean. The title of the presentation was this one, and we can say that multiple sclerosis can serve as a practical blueprint for how member states can adopt or update national neurology plans fully aligned with the IGAP. Next, why multiple sclerosis? First of all, I want to point out that since the year 2000, we started to say that early diagnosis and early treatments can change the lives of people. The time is brain. For an illness that is starting between 20 and 40 years of age, of course, we have also adolescents and elderly. Needing a lifelong care, we need a tertiary prevention, but we are working hard and we can reach the primary prevention and, of course, also the secondary prevention. Next. We worked with WHO for having in the essential medicine list 3 drugs. That was a start because we need more, but it is important. But it's not just a question of drugs, because MS care also requires timely diagnosis, MRI access, trained specialists, access to innovative and personalized treatments, rehabilitation, long-term support, and sustainable health care systems. Just for quoting an example of the lack of equity, we can quote one of our data in the atlas that is underlying how the vast majority of countries have problem in diagnosis with the new criteria, more than that. With the national guidelines and with national standards for MS care. So next, thank you. We wanted to point out when we speak about early diagnosis and access to care that the challenges in MS are the same challenges that we see across the wider brain health agenda. Next. We can consider MS as a good model for implementation, for integrated, lifelong, and multidisciplinary care, because the things I already quoted, that is the diagnosis, the pathways, the equitable access to medicine, rehabilitation, and long-term care, the health information, the data system are important, and they are the same priorities in the IGAP. And MS provides a practical example of how this can be implemented at country level. Next. We have to point out that global policy only matters when it improves the people's daily lives. We need concrete results. And this reflects the commitments in the United Nations Political Declaration that I have already quoted, that are the universal health coverage, the integrated people-centered health systems, the strong primary health care, and of course, reducing the inequalities. Next, thank you. When we speak about multiple sclerosis, the blueprint is not only care, is only a question of disability rights and social protection. And MS sits at the intersection of healthcare access, disability rights, rehabilitation, employment protection, quality of life, or better to say, life inequality, social inclusion, digital health, and economic productivity. Of course, I have not said that, but MS is a question of millions of people in all over the world, and maybe is underestimated. Next, we need to consider another issue when we speak about MS, and this is that we cannot improve what we do not measure. So monitoring is an issue. We need measurable targets. We need annual reporting and transparent systems for the monitoring. This is an important issue, and for MS we have registers, and we have also next we have Atlas and barometers at world level and continental level. We started an Atlas with WHO a long time ago. Now we worked to the targets when it was discussed that WHO, the neurological disorders, public health challenges, and of course we are updating year after year all the data on for the Atlas. But it is also another question that next that we should quote, and that is the need of a participatory governance and the brain economy. This is what we do at the MSIF level and in all the nations, because the most effective policies are designed with affected people. And the other issue that we should discuss is also the brain economy issue, because brain health is an economy issue, is an investment, and is not a cost. And this is one of the most important questions to be discussed with the politicians and the health systems. Just for giving you 4 examples, next. In Italy, already Dr. Iavicoli has quoted a lot of activities in Italy. We, as MS, in the MS Society, we have been working a long time ago for advocacy in the parliament, and recently adopting, we had the constitution of the parliamentary intergroup on multiple sclerosis and related disorders. That is the adoption by the parliament members of the MS agenda that was stated by all the stakeholders in Italy. And this is important to work together, all the stakeholders, and of course, including the Neurological Society in Italy. I give you 3 more examples, and next. We can quote India, for example. So there was a national advocacy activity for the reform of the national disability guidelines. So it was important collaboration. It was important stronger recognition of invisible symptoms and so on. United Arab Emirates for the first national MS treatment guidelines. Latin America for training for the pathways that are important. Next. Finally, I want to say that multiple sclerosis provides a practical starting point for this work, and it is a policy laboratory also for the national strategies. Connects clinical care, disability rights, prevention, research, workforce participation, and economic resilience. Next, MSIF advocates for national neurological and brain health plans, for equitable access to diagnosis and stronger data and accountability and minimum involvement, but also MSIF supports the integration of brain health into, and this is important, broader health systems planning. Next. Finally, I wanted to underline that brain health must become a priority. We call on member states for the adoption of national neurological plans, integrate neurological care into universal health coverage. We call and invest. We call on WHO for continuing to support countries' global monitoring and promoting brain health. And we call on civil society for the involvement of people with lived experience and strengthen advocacy, awareness, and accountability, and support equitable access. Thank you, and have a good meeting afterwards.
Thank you, Professor Battaglia. It is my absolute pleasure to introduce our next speaker, Donna Walsh, the CEO of the International Bureau of Epilepsy and founder of the OneNeurology partnership back in the day. Today, Donna is going to speak to us about advancing equity in epilepsy care and using the IGAP as a pathway to meeting unmet daily needs.
Thank you, Willa. It's my absolute pleasure to be here. I know you said back in the day, but it wasn't that long ago, and I'm not that old. But I'm pleased to be back within the wider neurology community, and fully embrace the point that we've just heard around how individual neurological conditions can be entry points or tracer conditions for work on broader brain health initiatives. Epilepsy is another great example, affecting over 50 million people across the world in both high and low resource settings where 80% of the burden currently lies, and of course affecting people across the life course from childhood right through to old age. But today I'm going to talk about how IGAP can be used as a pathway to address the unmet needs of people with epilepsy globally. If we look at the next slide, it shows that I am representing a wide community of 160 chapters, which is the word we use for our member organizations, across 110 countries worldwide, covering all 7 regions of the WHO and representing the voices of people with epilepsy and those who care for them. On the next slide, I've included our main 3 strategic objectives at IBE, making epilepsy a global public health priority, which is why we interact in forums like here at WHA, really trying to empower and amplify the voices of people with epilepsy and working to serve and support our member organizations or our chapters across the world. And ultimately, we want to see a transformational social change for people with epilepsy worldwide. Now, if you'd asked me that question 4 years ago when I started working at IBE in terms of what does a transformational social change actually look like, I probably wouldn't have been able to give you a very well-informed answer. But today I'm well placed to answer that question, and that is because at IBE, we've been working for the last 2 years to deliver our global epilepsy needs study. I'm pleased to say it's been published and it's available open access in Epilepsy Open, and the QR code, which you can see here on the screen, will take you directly to that manuscript, and I'm also happy to share the link with any of you who are interested afterwards. But through that study, we wanted to look at the day-to-day needs of people with epilepsy beyond seizures. Because as Mario said, there is no point creating global frameworks unless they really address what matters most to those people living with neurological conditions across the world. So this was quite a scientifically robust study. And if we look at the next slide, you'll see how we went about setting this up. So we appointed a multi-stakeholder expert advisory group. We worked with a scientific research organization in the UK called Medipace, and we ensured that people with lived experience informed every step of the research process. And ultimately, we came up with 2 main research tools, our Gen survey and a semi-structured interview guide. On the next slide, then, you'll see the focus countries that we covered as part of the study, covering low, middle, and high-income settings across, again, all regions of the world. We sought to collect at least 250 responses in each country and conduct at least 5 semi-structured interviews to dive deeper into that data. The next slide shows the sort of demographic segments that we covered, and I think you'll be pretty impressed, I hope, that we managed to collect almost 5,300 responses from people with epilepsy worldwide Carers were also invited to complete this study, but they were doing so on behalf of the person with epilepsy. So these are the needs of people with epilepsy only. And I think across the board, we also managed to cover different resource settings, a nice male-female divide, a nice socioeconomic divide, and of course also that urban-rural divide. Looking then at the next slide, you'll see that, of course, we covered healthcare and well-being, we looked at mental health, we looked at sexual and reproductive health, but we also looked at other areas of life that are important to people with epilepsy, looking at things like work and income, learning and education, driving and transportation, safety and security, and so on. And ultimately, we have come up with a top 10 list of the most frequently selected needs across these domains of life. And on the next slide, you'll see that breakdown. For me, these needs fall into really three main categories. So the first is really around access to healthcare, no surprise. People wanting faster access to healthcare professionals who would look at their wider healthcare needs, including mental health, and ensure they have access to the right treatment. There's also a bucket of needs here that really look at raising awareness of epilepsy, raising understanding of the condition within communities, building knowledge around basic seizure first aid, and ensuring that people with epilepsy get the support they need when they have a seizure in the community. And then the last set is really around sort of ensuring that we recognise and protect the human rights of people with epilepsy. Moving then to the next slide, you'll see here that we've merged both the survey data and the data from the semi-structured interviews, and we came up with 5 overarching themes that we feel really cover the experience of people with epilepsy across the world. The first is around navigating uncertainty and redefining daily life, not knowing when or where you're going to have a seizure, what that means for your day-to-day planning, but also into the future. Will I be able to stay at school, get a job, have a family? The second one is around living with risk, social exclusion and misunderstanding. And that's really around the stigma and discrimination that is still quite pervasive when it comes to epilepsy, people feeling vulnerable, particularly if they're having seizures in public places, and also the sort of wider safety risks that go alongside that. Challenges to navigating inaccessible systems. Yes, we're talking about healthcare systems here, but we're also talking about wider societal systems, education, employment, public transport. Consequences of inaccessible or inadequate information. People with epilepsy telling us they didn't have the information they needed to best self-manage and care, but also to take informed decisions about treatment options and other options of interest and of relevance to them. And of course, complex and rare epilepsies in particular demand more than just standard approaches. So ultimately, with this data, and you'll see on the next slide, we really believe that we have collected a comprehensive picture of the needs of people with epilepsy around the world. And we hope that this will be a critical evidence base to inform policymaking and decision-making, particularly when it comes to IGAP implementation globally. So the next slide will show you a picture of the front cover of our new Global Epilepsy Need Study Policy Advocacy Report, which we are happy to say, as of last night at about 10 o'clock, is now live. And we are pleased to provide, again, another QR code that will take you to that report if you're interested in taking a look. There is also a dedicated URL, genspolicyadvocacy.org. And within that report, you will see not only a breakdown of the data we've collected across the 10 domains of life that I showed you earlier, but you will also be able to see reflections from our community on why these things matter, examples of best practice from including people here in the room as to how we can address these needs, and also policy recommendations for action across those domains, but also a set of cross-cutting recommendations, which you'll see if we move to the next slide, please. So I know the writing is small, and I know this will be recorded, and you will see this on the website as well. But ultimately, a lot of what we're calling for here is what Mario has already presented. So I think what we're showing is that all of these things can benefit the wider neurology community. Strengthening human rights-based policy frameworks, developing national awareness campaigns, developing and implementing national plans, programs, policies, strategies, whatever we want to call them. Important to involve people with lived experience, to resource patient organizations, and of course, increasing the capacity of our health workforce, ensuring access to essential medicines, and providing comprehensive and holistic care. So I don't actually need to read these out because it's almost a copy-paste of what you've heard before. In finishing then, if we just move to the next slide, I wanted to make it clear that this is nothing new. So these things essentially are recommendations that are already contained within the IGAP. So by implementing our epilepsy-specific recommendations, member states are by default implementing IGAP and delivering on those strategic objectives. And if we just flick through the next 3 slides, you'll see where we have mapped our policy recommendations onto the specific strategic objectives and global targets of IGAP. So in finishing, just to say that IGAP is obviously underpinned by this intersectoral approach, informed by lived experience. And our GEN's policy advocacy report really yields itself to that ethos as well. And we really hope that together we can implement these recommendations, not just to improve the lives of people with epilepsy, but people living with neurological disorders across the world. Thank you very much.
Next, I am very happy to introduce Professor David Oliver, representing the International Neuropalliative Care Society. And Professor David Oliver is going to speak to us about the importance of palliative care in the neurology sector.
Thank you very much indeed for inviting me. It's an honour to be here, and we're delighted to be here. I'm a retired palliative care doctor and I've been very much involved in neurology care for many, many years. What is palliative care? It's the care of the person and the family. It's the care of people with life-threatening disease. And it's assessing and managing all aspects of care, their physical aspects, whether that's symptoms or issues about mobility, the psychological, emotional aspects, the social, most all our patients are part of wider families, and the spiritual and existential aspects. And it aims to provide that holistic care and maintain quality of life, and as been mentioned earlier, also dignity. So palliative care is much more than just end-of-life care, which often patients, families, and healthcare professionals just think of palliative care in the last few days or weeks of life. We're looking at much longer than that. It's more than end-of-life care, and it's an approach that really is good care. It's communication with patients. It's managing symptoms. It's helping with decision-making and goal setting. And it's part of all healthcare professionals' work. And I think importantly, over the years, we've become much more that it's at any time, in any place, and maybe from diagnosis, because it's according to need, not according to a diagnosis or a particular prognosis. And obviously within neurology, it's that progressive neurological disease, such as ALS or Parkinson's disease or dementia, palliative care is a very important part of care. But I think it also is important in other diseases. For instance, in stroke, the severe sudden stroke where death is perhaps very imminent, helping that person and their family is so important. And even in epilepsy, we talk about sudden death and the support of patients, the families after a sudden death. I'm very pleased that palliative care is included within IGAP, and it's also increasingly discussed in NCDs, because we're talking of the patients, and we're talking of family and carers, and we're talking before and after death. I want to stress that palliative care is not just for the specialist palliative care unit, the hospice, the palliative care unit, but it's part of all healthcare professionals' work. It's looking at that communication, that goal setting, and the symptom management, but with the collaboration and support of specialist services for the more complex issues, perhaps for education, for perhaps the ethical issues. and neurology patients have many, many issues. They may differ slightly from other disease groups. I think the one thing that's always struck me is that communication and discussion of the future may have to happen earlier if we're facing patients who are going to lose their decisional capacity. So we may be needing to discuss some of these issues about the future really before they and their families want to, but because they need to. And also we know that palliative care needs are often not met. So I would stress the importance to ensure that palliative care is seen within rehabilitation care and within all the care we provide for people with neurological diseases, and when IGAP is considered. I'm representing the International Neuropalliative Care Society today, but I know there are groups that I'm involved with in the European Academy of Neurology, the European Association of Palliative Care, and other organizations who also are very involved and use your local groups in palliative care and neurology. And don't forget palliative care. Thank you.
Thank you. Thank you for the speaker. That was very interesting and inspiring too. Now it's time to open the panel discussion. And I would very much like to start with going to representative member states who are with us today in the room. I can figure out some of them, but I think maybe we can start with His Excellency Minister Anil Kumar Batu, just to hear your reflection on the discussion that we had earlier, and whether there's one thing that standed out to you. And also would be very interested to hear about what sort of plans or things that the ministry have done in Mauritius, and if there is any plans for neurology in the near future too. So the floor is yours. Please, I would like to ask you to keep your intervention for 2 minutes. That would be really appreciated. Thank you.
Yeah, thank you very much. Let me begin by thanking you and the institutions for having organized this event today. And what I would like to say that while I belong to a small island state, and you know the multiplicity of problems that we don't have enough means also. And we have high burden of diabetes, hypertension, and obesity in our country. And we carry a great risk of stroke, vascular dementia, cognitive decline, and other neurological complications. And for this, definitely we need the support of our international organizations. It's not enough to state that countries to develop stroke units and advanced care pathways. Countries such as Mauritius, we need practical technical assistance, assessment of service gaps, training of neurologists and interventional specialists, protocols for thrombolysis and thrombectomy, tele-stroke support, regional referral models, equipment planning, and sustainable workforce development. And the same applies to rehabilitation also. Stroke care doesn't end when the patient survives the acute event. Survival without rehabilitation can mean lifelong disability, dependency, poverty, and suffering for families. Yet high-tech and specialized neuro-rehabilitation centers remain difficult to establish in countries like ours. We need support to build modern rehabilitation services, including psychotherapy, occupational therapy, speech therapy, neuropsychology, assistive technologies, and community-based rehabilitation. Similarly, there is also limited capacity in terms of super specialized human resources, such as pediatric, orthopedic surgeons, and pediatric neurologists. So we have got all these difficulties and problems that we face in small island developing states. And for that purpose, we would definitely humbly request WHO if they can help such countries in times of dire need. Thank you.
Thank you very much, Your Excellency, and thank you for sharing with us the challenges that there is clearly a political willing to make improvements for neurology, but there is also challenges that kind of been acknowledged, and clearly there is a need to be addressed. Thank you for sharing that with us. I'll go next to Dr. Buthaina from UAE. Please introduce yourself and if you wish to share some reflection with us.
Because I have it on my mobile. Okay. Good afternoon, everybody. I'm Dr. Abuthayna Ben Belela, Head of Non-Communicable Disease and Mental Health in United Arab Emirates, Ministry of Health. And it's my pleasure to be with you all, and thank you for this invitation. Today's panel highlighted an important truth. Addressing non-communicable disease and a neurological condition requires more than healthcare alone. It requires vision, partnership, and sustained commitment. What stands out is the determination to move from reactive care to proactive healthcare system, investing in early detection, awareness, digital health solution, and stronger cross-sector collaboration. The launching of multiple sclerosis guideline and development of a dementia framework in UAE are a significant step forward, reflecting a growing commitment to supporting patient, caregivers, and healthy aging through more coordinated and compassionate care pathway. And I'd like to add for Professor David, we are planning to have a national framework on palliative care, and we are in debate with oncologists and other NCD doctors. They are convinced that it's only for cancer patient and end of life, but we are 100% sure that it's for all NCD patients to improve their quality of life and to live longer with as much as we can, to give them a dignity and a good life. In the field of neurological condition in particular, this commitment brings hope for millions of patients and families who often face long and complex healthcare journeys. The progress we discussed today reminds us that meaningful change happens when a shared regional leadership drives a global impact, and how bold initiatives today can create healthier, more resilient societies for future generations. The conversation should not end with this panel. It should inspire continued collaboration, faster action, and collective commitment to improving quality of life of all. Thank you.
Thank you, Your Excellency. It was great to hear about the progress that has been made in UAE, especially as you mentioned earlier around MS guidelines and dementia framework. Also, you're working on palliative care, which I'm sure David will be very pleased to hear. And I think there is, as you were saying earlier, this is about partnership and collaboration, and there is, I'm sure there is a room for to share learnings, and because it's very much everything starts with political will, and then putting, adapting the global frameworks like IGAP and having a national framework, and this is sort of things will start to flow or come after. But it was really interesting. One word that stands out for me: proactive healthcare. And I think as much as we're trying to catch up and make sure that people actually get the treatment and the care they need, but we also need to be mindful of the prevention and because that will bring about big change, whether that's for societal change or economic change for any country. But thank you so much for your reflection. May I ask if we have any other member states representative in the room? If you can wave your hand, please. Please, good. Can you introduce yourself, please, and share some reflections?
Okay. Good afternoon, everybody. Dear chairpersons and organizers, thank you so much for this good opportunity to share more about our neurological disorders event. I'm Dr. Anke Hong. I'm the Vice President of the IBE International Bureau for Epilepsy. Actually, I'm also serving in the Western Pacific region as the Vice Chair, as the chairperson. My background is a social worker with training on public health and also disability in Hong Kong. The WHO Western Pacific region is a home to about 2.2 billion people across 38 countries and areas. Within this huge population, epilepsy affects millions of children, older people, and adults and their carers in China, Malaysia, Singapore, Japan, Hong Kong, and many other countries. However, it remains a condition shadowed by stigma, undertreatment, and also social exclusion, especially in our very unique but diverse cultural context of the region. Epilepsy is not only a neurological condition, it is also a public health, non-communicable disease, NCD, chronic disease, and also human rights issue. So in our high income, middle and low resource rural communities in the Western Pacific region, our people, the people with epilepsy, face the same challenges, such as difficulties in accessing healthcare, anti-seizure medicines, stigma, high rates of anxiety and depression, fragmented health and social care systems, unemployment, and access to education. It's a pity that there's also a strong misunderstanding of epilepsy in the society. We are glad that IGAP, that is the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorder, give us a very clear framework with 5 objectives. Especially the 5th objective explicitly calls on countries to strengthen the public health approach to epilepsy, including the target 5.1, that is by 2031, increase epilepsy surface coverage by 50% compared with the 2021 baseline, and target 5.2, that is by 2031, 80% of the countries will have developed or updated legislation to protect the human rights of people with epilepsy. Regarding the increase in surface coverage, we are particularly concerned about the access of health service, especially access to anti-seizure medicines, the psychosocial and self-management support to patients and also to the patient groups. As for the legislation protection, it is critically important to ensure protection for persons with epilepsy in terms of their education rights, employment, and others. So in the Western Pacific region, some IBE chapter members, we have already begun some IGAP-related evaluation work, and it will be highly valuable to integrate insights from WHO, OneNeurology, World Neurology Federation, International League Against Epilepsy, and other stakeholders to co-create a standardized regional applicable set of IGAP indicators for people with epilepsy and other neurological disorder. Finally, in closing, I called on WHO member states, non-state actors, neurologists, health and social care professionals, and people with epilepsy to strengthen global, regional, national, high-level, and cross-sectional and cross-sectoral collaboration so that we can align our policies, plans, and services with IGAP and also with the SDG, so that we hope that we can turn IGAP from a promise on paper into real change in the lives of millions of people with epilepsy in Western Pacific region and the worldwide.
Thank you. Sorry to, but it's all really strong messaging in there, and very good to hear about some of the initiative that has been already undertaken in relation to IGAP. And as you were saying earlier also about the, there is many challenges that shared across neurological conditions. So that's even more reason for us to work together collaboratively. We're in the World Health Organization headquarters, so it would be a shame if we didn't ask some of the member of the staff of the WHO to share their reflection with us today. So I'm going to Niraja for your reflection, please.
Thanks a lot, Abdul and Orla, and hello everyone. I'm Nirja Chowdhury from the Department of Non-Communicable Diseases and Mental Health. I'm still getting used to it. No, it's been great to see the interest from such a diverse range of stakeholders in this room for brain health. I think it tells us how important brain health is in the public health agenda, not least because of the burden, but also because of the inequities and the large treatment gaps that we see worldwide. We heard mention of the global status report on neurology. I think just to also emphasize the point that it's only half of the countries that actually provided data for this report. And what the report shows us very clearly are the disparities. We have in low-income countries 80% fewer neurologists than in high-income countries. If we think about supports for carers, it's about 15% of countries reported that they have these supports in place in low-income countries versus 70% in high-income countries. And also, if we look at research output, It's twice as much as in high-income countries as compared to low-income countries. So I think this kind of emphasizes to us that while all countries are way behind in reaching IGAP targets, there is a disparity. That's why it was great to hear about also Italy's initiative towards the brain health strategy, and also the work in dementia and Parkinson's disease that is ongoing. And we've also heard from Mauritius as well as the United Arab Emirates. I think what this tells us is that there is ongoing work in countries and we can learn from one another. There are good practice examples that we can draw on. There are lessons that we can learn of how countries have addressed challenges in terms of their neurological response. And what we have is this umbrella that IGAP provides us. It gives us this common platform for us to then be able to accelerate progress. IGAP gives us what is this integrated approach, but we've heard also that there can be entry points. Countries might have different priorities in terms of, we heard from, it might be MS in some countries, it might be epilepsy in some countries. And when we improve services for one neurological condition, there is opportunity for us to then improve services for all other neurological conditions too. So I think working together, looking at how we can then provide this integrated approach that IGAP speaks about is extremely important. And speaking about integration, I think we are also talking about integration across the spectrum of care, from promotion of brain health to prevention of neurological conditions, to treatment and care, including rehabilitation and palliative care. I think that's something also that IGAP provides the structure for, as well as integration across the life course. Let's not forget the neurological conditions can be affected even from the preterm period to early child development and neurodevelopmental conditions, right through adulthood to older age conditions such as dementia. I think what also we're hearing is that all of us have a role in this journey. It's not just the countries or the member states or governments who need to act. WHO has its own role to play, and you'll hear more about it from my director. But it's also people with lived experience who need to be at the center of this response. They need to tell governments what they need to see done, what are the outcomes that they are looking for, what are their needs, and of course, civil society organizations to provide the platforms such as this one, where we can all come together and advocate for better neurological care worldwide. Thank you. I'll stop here.
Thank you very much. It was very great to hear your reflection. I'll go back to the non-state actors organization representing the conditions that we've done era for, if there is any further reflection on after hearing from member states and WHO. So let me go to Lydia Makarov to give further reflection on MS, if you wish. Thank you.
Thank you. Yes, so as we've heard today, multiple sclerosis really shows both the challenges and the opportunities that we face in neurology globally. Now, in many countries, we have the scientific knowledge, we have the diagnostic tools, and we have the treatments. And we know that earlier diagnosis and access to treatment can save lives and slow disability progression. But as we can see here in the World Health Organization, where someone lives still has a huge impact on where, if they can access timely diagnosis, specialist care, treatment support. In many countries around the world, people with multiple sclerosis are still waiting years for a diagnosis. Access to MRI remains limited. There are shortages of neurologists and rehabilitation professionals, and that is why these neurological action plans that we're hearing about matter so deeply. And as Mario has said, multiple sclerosis can provide a very practical example about how countries can improve and strengthen neurological care across the whole healthcare system, from awareness, early diagnosis, through to treatment, rehabilitation, long-term community care, and palliative care. And so we're very lucky that the World Health Organization has produced this excellent intersectoral action plan. And that gives us a real framework for action. But implementation is now the key part. And here at the Multiple Sclerosis International Federation, we are working with all of our members across the world. And we see that every day progress is possible, as Mario has shown. All across the world, our members are making true progress, working with governments and clinicians and communities to work together. So now is the time to turn these global commitments into real national action for people affected by neurological conditions.
Thank you, Lydia. I'll go back to you, Donna, again to just give you last reflection.
Yeah, thanks, Abdel. I don't think I have anything to say that hasn't really been said already, but I think for me, what we've seen today is that there's a lot of good work happening in pockets. I think we need to really ensure that we are reducing that fragmentation. I think as a neurology community, we've often been guilty of competing against each other rather than working together to really position brain health centrally on the agenda, not just between conditions, but actually also between disciplines. I think what's also clear is that we can't sit in our own neurology bubble. This is a broader societal issue. I think we need to ensure that we have not just ministries of health engaging with us, but social protection, employment, education, if we really want to drive change for people living with neurological conditions across the world. And ultimately, I think if that is to happen, we need member states to take up the mantle and to develop these plans that are really taken forward. I think if we look at the global status report on neurology, and correct me if I'm wrong, Nirja, only 16% of countries actually have standalone plans that really encompass that wider approach to neurology or brain health, and that's nowhere near enough. So I think if we come back here again next year, I'd like to see that number really increasing and increasing quickly, and for all stakeholders to have come together to make that happen.
Thank you, Donna. I would like very much really appreciate some intervention from our colleagues from China, sitting at the back of the room. If you would like to, sorry to put you on the spot, but like if you wish to share your reflection on the discussion today, that would be great. Please take a seat.
Thank you, President. Distinguished guests from all over the world. I'm from China. My organization is the National Mental Health Center. It's a great honor to address you today as a member of the Chinese delegation. The WHO's Global Status Report on Neurology understood the profound global burden of neurological disorders. In response, China is fully committed to translating the vision of political declaration on NCDs and the intersectoral global action plan into peaceful, impactable national actions. First, I would like to highlight our strategy integration in system building. Under the Healthy China framework, brain health is deeply embedded in our life cycle health management. We are moving beyond reactive clinical treatment to a prevention-first defense, establish practical barriers through early screening and active intervention before disease progress. Second, we are response service brands and support signals regarding workforce and medicine. In talent development, China is empowering primary healthcare professionals through digital tools and standardized clinical pathways. This enhances the ability of general practitioners to identify and manage conditions like something difficulties, disease at the community level. Regarding accessibility, our innovative national health insurance negotiation mechanism has successfully included high-value neurological drugs into the SUS insurance category. This significantly reduces the financial burden on patients and ensures the scientific breakthroughs reach every family. Furthermore, we are pursuing precision and depth through scientific innovation. China is actively unitizing large-scale, multi-dimensional biobanks coupled with proteomics and mechanism to identify biomarkers, especially to Asia population. Finally, regarding rehabilitation and international cooperation, China is committed to bridge the gaps between hospitals and society. We are constructing a comprehensive three-tier rehabilitation network that extends service to communities and homes, ensuring that patients receive necessary dignity and support throughout the various stages of their journey. Thank you.
Thank you very much. It was great to hear when you said trying to have the full commitment to implement the UN political declaration, and I think that is really important. Equally, it was also very insightful to hear about when you said about equipping the primary health care with the tools so they'll be able to sort of pathway, because that's eventually the entry point for anyone with a neurological condition. And this is where many people actually have a delayed diagnosis and not being able to know what would happen next. So I think calling this out is absolutely important point. Thank you so much for sharing your reflection. Now I'll over to you, Orla, to introduce next speaker.
I have the very lovely job of introducing the last speaker for today on session 2, From Commitment to Action, what the 2025 UN Political Declaration on Non-Communicable Diseases means for our community, the neurology community. So I'd like to introduce Dr. Deborah Castell, Director of the Department of Non-Communicable Diseases and Mental Health from the World Health Organization.
Thank you. Thank you very much. Save it for later and see if you still agree. So yeah, it is a real pleasure being here today. And I was thinking that I think all and every speaker mentioned the IGAP or some of the work that we do, and that gives these are very intense times. Sorry. That gives the pleasure of knowing that what we do matters, and the satisfaction of that. And I better go back to the written notes so I don't risk to go too much into that. But I think it is not so common that we hear every partner talking and making reference to the work that we do. My mother-in-law would say you hit the nail, right? So that is probably the case here. Sorry. Then back to my written notes. As you all also mentioned, in December 2025, the UN adopted the political declaration on NCDs and mental health. I'm saying this because it took us some effort to get there in the title of the political declaration, and having for the first time a fully integrated NCD and mental health agenda. And we did that, within that mental health agenda, we managed to have, and again, it was thanks to the support from many member states and civil society organizations, to have recognized neurological conditions such as epilepsy, dementia, Parkinson's disease, and the long-term consequences of stroke. And that means that the political declaration acknowledges that neurological conditions are closely interconnected with non-communicable diseases and mental health, and that people living with these conditions often face higher risks of poor health outcomes. And this is obviously a significant step forward, because for too long, neurological conditions have remained under-recognized, despite their substantial contribution, as we all know, to disability, mortality, and reduced quality of life. The WHO Global Status Report on Neurology, also very much quoted today, highlights the growing global burden of neurological disorders, the inequalities that Nirja just mentioned in access to care, the critical gaps in primary care, primary health services, essential medicines, workforce capacity, and data systems. So now that is beginning to change. This progress builds on momentum that has been growing in recent years, and we heard also examples from countries, right? And in particular, then with the endorsement by WHO of the intersectorial, the World Health Assembly of the intersectorial Global Action Plan on Epilepsy and Other Neurological Disorders, or IGAP. I'm very pleased to hear that everybody knows it by the nickname, not even the full name. We are specialists in creating acronyms and nicknames. So that was adopted by all member states in 2022, and it provides a clear and comprehensive framework to address neurological disorders across the life course. Now, the political declaration reinforces IGAP at the highest political level, creating alignment between different mandates. It also sets out concrete commitments with a set of specific global targets for 2030. For neurological conditions, these commitments are critical. It means moving beyond highly specialized services. It means also ensuring that care is available closer to where people live through primary healthcare systems. It means improving continuity of care from prevention and early diagnosis to long-term management, rehabilitation, and palliative care, as we heard very clearly earlier. And importantly, it means ensuring that neurological services are included in universal health coverage benefit packages. We heard about some essential medicines already included in the list. And therefore, people should be protected, better protected from financial hardship. At WHO, we are already supporting member states to move from commitment to delivery. Through the IGAP implementation, workshops held across multiple countries, especially in the Afro and Euro regions, where we are bringing together representatives from ministries of health, clinicians, NGOs, partners, and people with lived experience of neurological conditions. And together, they review the national situation, each one of the countries, they identify priority gaps and define practical next steps for implementation. So one clear message has emerged from this work. Countries are ready to act, but they need structured support, practical tools, and strong multi-sectorial partnerships. From our side, WHO has developed a range of technical resources, including the IGAP implementation toolkit, the MHGAP that was also mentioned many times yesterday during the member states' statements, which was great to hear, which include neurological conditions such as epilepsy, and is the tool to enable a task sharing at primary care level. Also, we have worked on the guidance on improving access. We are working on the guidance on improving access to essential medicines, and we are supporting developing national registries and data systems. Colleagues, the combination of the political declaration, the IGAP framework, and WHO's growing portfolio of implementation tools creates a unique opportunity for neurology, an opportunity to bring neurological conditions fully into the global health agenda, to reduce inequities in access to health, and to improve the lives of millions of people. The real test now is implementation. As before, WHO stands ready to support member states and partners in ensuring that this leads to all this context leads to tangible improvements in the lives of people with neurological conditions and their families. Thank you very much.
Thank you very much. And yeah, it was again, clearly there is message around we need to move from commitment to delivery. And it was great to highlight, once again, to highlight the point that there is a technical resource out there that the WHO team have produced in order to enable member states to take things forward. I think we've everyone heard enough. We really appreciate you joining us today, despite the very busy week. That meant a lot for us. And I very much would like to end with the same sentence I started with, which is we want to leave this room with a shared sense of responsibility and action. And I urge you to take this away. Thank you so much for joining us today. I've been reminded just to acknowledge that our colleagues at the Alzheimer Disease International were supposed to join us today, but unfortunately, due to unforeseen circumstances, they had to fly back to the UK. But we just want to acknowledge their support to make this event happen. And thank you. Now I end with this.